Hi, I'm Nazrin Shahnaz from Shahnaz Interiors. We inspire to build smarter healthcare through better interior. So today, I would like to share with you a topic that is very close to my heart, and it's about branded environment. Why is it so? Because I think it is not so much popular and yet to be implemented in Malaysia. Before I go directly to the topic, I would like to clarify on certain terms. Branding is not simply about possessing an eye-catchy logo. The true brands creates a clear understanding about what the whole company is all about. It is what is being able to communicate to their customers to build credibility and help them to stand above all competitors. A brand that values health and well-being will be appealing to more patients. So while logo and marketing materials immediately come to the mind, branding is so much more than that. In today's world, hospitals face aggressive competitive environment. It's not just about the number of competitors, but it's about customers who wanting to know more, demanding more. They are well informed, so they want a better cost versus quality. Sometimes when you walk into a hospital, you can have a sense of what the hospital is all about. Some hospitals are very chaotic and less sophistications, but some hospitals are very empowering and very welcoming. So the best thing about it is that this kind of impression really lasts longer than even after you step out of the hospitals. So what is branding? Branding is about the set of emotions and perceptions that you instill intentionally in the company as well as in the mind of consumers. And it's about setting out a series of visual and verbal cues. Like for example, when we take a comparison between KPJ and Prince Scott, you can sense that there is a different sets of communication messages and it is appealing to certain target audience and vice versa. What is branded environment? It's actually a work of making space aligned with your brand messages and direction. It's simply about what the kind of message you want to put forward to the customers. People often choose branded products or services and they become advocate for that kind of brand. This is why brand needs to be exciting, dynamic, trustworthy and empowering. Branded environment is really valuable intangible assets that can sustain itself throughout the competitive markets. It helps companies to attain reputational values and superior performance. There are 7 ways to achieve branded environment. First is the facade design. It's the first impression you get about the hospitals. When it's clearly been done, the facade can actually give a sense of the company's identity. Point number 2 would be biophilic design. It's about integrating greenery or natural elements such as light, water and all sorts of natural elements in the interior, which evidently affects people's perception about the place. More and more hospitals are adopting to wooden textured vinyl, having water elements in the community gardens, adopting to larger panels to allow natural lights flowing in. Point number 3 would be color design. The psychological impact of colors in healthcare settings is evidently proof to improve mood of a people who is currently anxious, emotional and disorientated. The usage of corporate colors was predominantly very popular, but nowadays people are more focused or going towards choices of colors that is earthy, pastel colors with a splash of bright colors in the common areas. Even these bright colors are actually taken from their corporate identity. So point number 4 is identity design. In order to actually build the connection between what the customers or the company is all about and to shape the same perception in the mind of consumers, hospital uses murals, stickers, decorative murals to share their brand stories. New Medical University of South Carolina went extra miles to design the acoustic, lighting, air quality, furnishing, finishes, graphic and wayfinding with their patients and also the hospital management team, even before architect was even being appointed. So it was a very creative way to show that there is actually coherent between what the hospital is trying to project and what the customers understand about the brand. Thematic design. Hospitality and healthcare settings have to accommodate to everybody's level of mobility. While being comfortable and relaxing, it is about defining the healthcare to promote functional luxury, taking into consideration the sense of touch, sight, emotions, and hygiene needs. One of the most effective ways to make lasting impression on your customer as well as your employees is to implement branded environment in their workspace. Take for example, Link chair or beam chair is commonly used in front of the waiting area, but nowadays people are adopting to corner bench, which is more comfortable to patients as well as their families. Point number 6, material design. A strong visual identity distributed throughout the multiple spots in the facility can actually reinforce the brand awareness in the hospitals. There's actually an emotional connection between what is being achieved through the use of lighting, colors, patterns, space, which can actually bolster the brand image and inspire loyalty in the eye of patients. Number 7, wayfinding design. Simply put, wayfinding is about getting to point A and point B. But nowadays, wayfinding serves to guide patients and visitors in their surrounding to enhance the understanding for them to travel safely, securely, and at ease. Nowadays, designers are more creative to use bright colors, symbols as a signage navigations. While another emerging trend is to incorporate technology into signages. For example, using touch-free kiosks or mobile wayfinding technology, which is easier to navigate and may elevate the end user's experience. With all that being said, the perceived value of a hospital is elevated through branded healthcare environment. The patients are willing to pay more for tangible benefit that they receive from the hospitals in the presence of strong branding. Eventually, this can help to build trust in the mind of patients, to boost confidence about the quality of services that they receive from that hospital.